I'm Dominique Fons. I just wanted to post a video for my patients with low back pain. So I'm going to be showing you some stretches in the beginning and then some exercises to reactivate your buttock muscles and stomach muscle. So the first stretch is for a back muscle. So you're going to lie down on the floor. And you're going to put your feet together and knees together. You're going to put your arms out. And then you're going to cross one knee over the other. And the top knee is the side you're going to twist towards. You want to make sure you keep the opposite shoulder down. You may not go as far as I go, and that's okay. Make sure that you breathe with your rib cage. And just let gravity take you. If this is too much, then put some pillows underneath your knees so you don't go as far down. If your knees can't quite go that far, then you put them together as close together as possible and then do it. Now, the general rule for holding this position is about 5 breaths inside and out, in and out. And notice when you exhale, you'll go down a little further. And then if you need help, you can bring your legs up, or you can attach a belt strap and you can actually pull your legs up, or have some family member help you. And then you cross the other side and you twist again. Top knee is the side you twist towards. Big breath in with your rib cage. You may have a pop in your low back, and that's okay. Don't force it. Again, you're breathing in and out. Now I did about a couple inhalations and exhalations, but you want to make sure that you do it for at least 5 to 6. And I repeated to each side at least a couple of times, especially if you notice I can't quite go down to the floor. I usually can, so I should probably repeat each side. If it causes pain, back away from the pain. Again, put something underneath your legs, so that way you don't hurt yourself. So again, pain is not your friend, and I want you to back away from it. The other exercise I would like you to do is a pelvic tilt. I'm going to teach this on a chair. You can do this on a ball. You can also do this on the floor, but I find patients have it easiest when it's on a chair. So you want to sit so that you're pretty close to the edge of the chair. You're going to put your hands on your hip bones. Actually, they're your pelvic bones. And what you're going to do is you're going to just tilt your pelvis up and tilt it down. And notice I'm not using my shoulders. I'm just tilting my pelvis. I'm not moving it super fast. And it should feel good. It should feel like a stretch. If it is painful, you need to back off and go the opposite way. You don't want to push through any pain. So I do this for 10 to 20 cycles, depending on how my low back feels. You will feel it in the very, very low parts of your back, and that's where you need to feel it. Next, after you do 10 to 20 pelvic tilts up and down, we're going to do a pelvic swivel. So your pelvis or hips are going to actually move side to side and swivel. I want you to keep your upper body straight and tall, and you're going to actually point out from your hips. So you're going to actually point with your knee. So you're going to just point forward with your knees. Notice my shoulders are not moving. Nice and easy. You're going to feel it in the very low part of your back, because that is the joint that is actually being affected. And that is that is a very common place for low back pain. Okay, so I do this again for 10 to 20 swivels. I can do this in the car. I can do this standing, lying. So if you have pain in that low back part of your back, also called your sacroiliac joint or SI joint, you can also get some relief with that exercise. I want to do 3 more exercises, and this is to help your stomach muscle, and the last 2 exercises are to help your buttock muscles. So for your stomach muscle, you're gonna lie on your back. You're gonna feel your pelvic bones again, just like you were doing for the pelvic tilts. You're gonna put your feet together and knees together, and you're gonna feel your pelvic bones. They should stay together. They should not move. Now, if you bring your one knee out, you will feel your pelvis actually drop at a certain point. It feels like it's tilting and rotating forward. Your pelvis should not do that. So we need to strengthen that stomach muscle. It's called the transverse abdominis muscle. And to do that, you need to pull your belly button, not suck it in, you pull it into your back. This is a Pilates maneuver, so I want you to pull the belly button into the back. Start knees together, heels together, belly button into the back, and slowly bring your knee out until you feel your pelvis rotate. Then bring it back, pull the belly button in again, slowly bring it out until you feel the bone rotate. Do that 10 times each side. You will find one side is a little weaker than the other, and that is okay. That's very normal. And again, you should have your belly button into your back. If you are feeling a pull in your back, that means maybe your pelvis is not in neutral. So try tilting the pelvis just a little bit. Pull the belly button in. And again, until you feel the pelvis rotate out. Okay, so that is for the abdominal muscle, the stomach muscle called the transverse abdominis. The next exercise is for a buttock muscle that stabilizes your pelvis. Okay, and that is a top muscle that goes along here. You're gonna lie on your side, knees out and bent. You want your feet tucked under your buttocks and in line. You want to keep your torso, you want to keep your pelvis and hips straight up and down from the floor. Okay, this exercise is to reactivate this top muscle, this buttock muscle called the gluteus medius muscle. So to activate this muscle, you're going to do a leg lift. So you're going to straighten the leg straight out from the hip. So notice I'm not lifting it high or low. It's got to be straight out in line with my hip joint. You're going to turn the toe. So notice my toes are flexed toward my head and rotate it out. And you're going to pull your leg, pull your heel out from the hip joint for 1, 2, 3, 4, 5. And then you can repeat that again. Again, straight out from the hip, toes up toward the head, rotate that leg out, pull the heel like you're elongating your leg, pull the heel out for 1, 2, 3, 4, 5. For those of you in the medical profession, that is an eccentric contraction of the gluteus medius muscle, which is essential for reactivation. Okay, to strengthen the gluteus medius, you just do a clam maneuver. So feet, heels together, and all you do is bring up the one knee. Again, don't rotate the pelvis, just bring that knee up, hold it for 5 seconds or 10 seconds if you can handle it, and then bring it back down. Repeat a couple of times. You should do this for both sides, especially if you have weaker buttock muscles. The final buttock muscle I'm going to have you reactivate, this is the toughest one, and you should not be doing this one until I tell you to do it, because you have to activate and turn on all the other muscles that we have worked on until now before you can do this muscle. Okay, so this is called the gluteus maximus muscle. It's the largest muscle in your buttock, and we are trying to reactivate the inside portion of it. So many of you have been given physical therapy exercises where you go into a bridge. This, you're gonna have your knees apart, about shoulder width apart. You're going to put your hands down on the floor. You're going to pull your belly button into your back. And you're going to bring the toes up, dig the heels in. You're going to push the heels a little bit out into the floor. So if you see how I'm pushing my heels away from me, that's how you know that's the right direction. Then you take, this is the muscle I'm going to reactivate. So I straighten that leg, you pull the leg out from the hip socket, 1, 2, 3, 4, 5, and you bring it down. You're gonna repeat that, start with 3 to 5 seconds. Don't do that too much. If you feel any cramping, immediately go out of the bridge so that way you don't hurt yourself. Then to turn on the other side. So I'm gonna reactivate my right side. Again, shoulder width apart. I'm gonna go bring my pelvis into neutral. Okay, I'm gonna bring my belly button into my back. I'm gonna dig my heels away. I'm gonna support with my arms. And then I'm gonna straighten that back leg and pull it out from the hip. 1, 2, 3, 4, 5. Bring it back and come on down. You can repeat this each side 2 to 3 times. These are the basics to reactivate your buttock muscles and to help your low back be pain-free. See you in my office.